The surgeon removed a large portion of the man's skull,
This is common in brain surgery when you have to get in there.
intending to reattach it later during an emergency brain surgery. After several weeks, his brain had healed and was ready for the piece of his skull to be reattached. But the hospital staff couldn't find it. So instead, they used a synthetic piece, which later became infected.
This is really horrible. They lost track of that. Yeah, anything foreign in the body, any type of implant always has a risk of infection. That's sad.
And the hospital still charged him $19,000 for the synthetic piece.
So hospitals will always charge. You know, that's the way they work.
Now the man is suing the hospital for negligence, seeking compensation for his suffering and medical expenses.
Yeah, I'm sure he's going to get a good payday with that.
If you swapped brains with your mom, would you be you inside your mom's body?
First of all, obviously this is not possible. Once you sever the spinal cord, you can't put it back together. Then there's immune rejection, and there's all sorts of ethical issues associated with this. I don't think you would be you or your mom would be you, but it's kind of an interesting topic for debate.
If your nose gets sliced off, doctors can place tissue expanders under the skin of your forehead. Once it is stretched out enough, they'll shape it into a nose. Then they take some cartilage from your rib cage and craft it into an internal structure.
So this is interesting. I've not really heard of using a tissue expander to expand it. What they do is they can rebuild cartilage. They can take it from your ear. They can take it from your rib to rebuild the cartilage. And then they would usually use a forehead flap to cover it up, and they might use some internal flaps to create the lining. But that's the most common way I've heard this done.
Seen someone with extra fingers or toes? It's called polydactyly.
So this can be genetic and environmental. Also, some people basically have these and don't have any problems whatsoever, but they can also be related to certain syndromes, which are genetic.
This happens when a small change in genes sends extra signals while a baby is developing in the womb. As a result, an extra finger or toe forms. Some are fully functional, while others are just small bumps. Would you keep an extra finger if you had one? Let me know.
So would you keep an extra finger if you had one? Well, most people are otherwise healthy. It can be related to sometimes exposure to certain chemicals during pregnancies, which can cause this, but also certain syndromes as well.